I have disc pain and I don't know what to do next. This is a common thing that comes into MMT where people come in with low back pain and they've heard or read about slip disc, herniated disc, bulging disc. What does it all mean? Well, a lot of it has to do with some common terms versus what's pathologic. So we're going to get into not just the nomenclature, but also how we may treat disc and why. So how a disc happens can be through a variety of things. One, from just time being compressed. Flexion and twisting are most of the common mechanisms that we see. This is not usually has to do with load, like we see in movies where somebody bends down to pick up a very heavy couch. A lot of times they bend down to pick up something in the shower or pick up something off the floor that's relatively light. So it doesn't always have to be the load. It's sometimes one of those scenarios where the load that breaks the camel's back. So here I have drawn very nicely, these would be lumbar vertebrae. We have our vertebrae and then the disc sits in between. Depending on how the disc bulges or herniates are two different things. It just has to do with a different type of nomenclature that kind of comes up more from the radiologic standpoint, not necessarily from the clinical standpoint. Clinically, we can see things such as like, these are usually flexion sensitive movements. So bending forward hurts, sitting hurts, or twisting in bed at night it hurt. And they're usually diurnal. Pain is usually really bad in the morning. It feels better when I'm on the move throughout the day. And then again at night, my back starts to hurt. So we see this diurnal pattern and there is flexion sensitivity. With a disc bulge doesn't always have to mean that there is pain running down the leg, like with a sciatic type pain, unless that disc bulge is pushing against the sciatic nerve. Then we might see a little bit of both. But we can also see like a underlying nerve tension where we can do some nerve tension tests where that nerve can be getting caught up. So in our diagram here, you have two parts to the disc. You have the nucleus pulposus and then the annulus, which is kind of the up part. This is in our diagram, it'd be our normal. This is our abnormal. What ends up happening, you can see this where the disc has been starting to worm through. Sometimes it's through repetitive movements. Like I said, there's not just one clear cut on things, but we can see is flexion, extension patterns, but flexion with gravity. Those can also, and compression patterns, that's where we can start to see this. So as it kind of worms its way through, depending on if it's traumatic or something that kind of comes up over time, can develop on how the disc will change. So you can just have where the disc starts to change out. So it goes from being this relatively flat, where it starts to bulge relative with this going through. Then what can end up happening is the disc material can keep pushing through and you get like a focal lesion where this kind of pushes out and we get more of like a hanging fruit kind of hanging off of it. What ends up happening in fragmented cases is this comes out and then separates out. So we get some of the jelly outside of the donut, will you? And then when this is the nerve canal, it can do a variety of things. It can stick onto a nerve root, it can hang out there. The good news is our body's constantly healing these things. So the body does heal itself. And we'll talk about some of these normal patterns and things that come up next.